morning, William. How are you doing today? William? William? I'm Dr. Jones. Do you remember me? We met several times since you've been here at Alexian. William, can you tell me the date today?
If this is my Garden of Eden, then where is God? I've only spoken to the devil, but I haven't heard from God. Maybe I'll take a boat.
Well, William, today is July 7th, and you're at Alexian Brothers Hospital. How are you feeling today?
Doctor, Billy's parents are here.
Send them in. Good morning, Mr. and Mrs. Friedberg. Please sit down.
Hi, Billy.
Hi, Billy.
Morning, doctor. Thank you for seeing us.
Thank you for coming in today, Mr. and Mrs. Friedberg. I know that you have been very anxious over William's condition, and I wanted to give you an update.
We appreciate that, doctor.
As you know, I've been working with Billy and interviewing him since they brought him in last week. As you know, the police found him outside the 7-Eleven. He was shouting, waving his hands wildly, and although no one was around, he seemed agitated and distraught.
Yes, doctor, that is correct.
You noted last week that William had been exhibiting these symptoms for a few weeks. Is that correct?
Yes, that's true. I actually can remember an incident that recently happened. I believe it was maybe March or April when Billy was sitting in the kitchen around 11 or so at night, and suddenly he stood up and just screamed, "No, no, I'm not, stop, no," and he just ran out of the house in his pajamas, and we found him 20 minutes later several blocks from our home and still arguing with himself.
Yes, I remember you did mention that. William has confirmed that he hears voices often. These hallucinations tell him things like he's worthless and he's continually demeaned about.
Well, what's causing that, doctor? Is Billy sick? Will he need surgery?
Well, as I mentioned, we have been working closely with William since his arrival and assessing him and obtaining information from interviews with you and your other family members. In addition, we did some lab work and some CT scans to see if his brain's okay and to rule out any other illnesses, and all of them came back negative.
Well, thank God, that's great.
Yes, we found no evidence of a brain tumor or any abnormalities. But I'm afraid that William is ill. He is suffering from a mental illness. Based on our information that we've gathered and the length of William's symptoms, I'm afraid that William is schizophrenic. William, as you know, William's been suffering from these delusions and hallucinations over at least a 3-month period. Additionally, you noted last week that William dropped out of school at the U of I. He has been unmotivated and withdrawn, at times apathetic, and it's hard to interact with.
Yeah, that's true. It's like he has no emotions, whether he's happy, sad, or afraid. We can never tell. His expressions, his demeanor, they reveal nothing.
Well, someone's outward manifestation of emotion, that is what we refer to as affect in the medical community. Schizophrenics often have a flat or blunted affect, meaning that they show little or no emotion. All of these factors are symptoms of schizophrenia. The lack of motivation, the apathy, the emotion, the hallucinations, and delusions. I know this must be difficult, but with the medications available today, William's symptoms can be controlled.
Now wait a minute, Doc. I mean, how is this possible? There must be some mistake. It's just not possible. No one in our family is insane, and there's no way our son could be.
If this is the Garden of Eden, and I am Adam, where's the dog?
I know it's difficult to hear, Mr. and Mrs. Freeberg, but the diagnostic criteria are very specific, and William's behavior and symptoms fall clearly within the parameters.
No, it's just not correct. God damn it, it's not right. You need to run more tests. Your criteria are wrong. Wrong.
Jack, stop it. Calm down. You're upsetting Billy.
Fine, I'm calm, Kathy. Damn it. I just wanted to know what is going on with our son. I mean, he's our son for Pete's sake.
You don't think I know that?
You don't think I know that? You don't think I know that? You don't think I know that?
I'm sorry, doctor.
Oh, no need to apologize. I understand that this is a very upsetting time.
I just wasn't... How can you be so sure?
As I mentioned earlier, since William's return from college last fall, you noted that he is withdrawn and unmotivated. His appearance is unkempt and his hair growth is grown out and it's in tangles. He has not found a job nor reapplied to school. Additionally, you noted that William does not see his friends anymore and that his relationships with you and his siblings have significantly deteriorated.
Well, yeah, that is true. He just doesn't seem to care anymore. It's like he forgot how to connect with people. He doesn't even exercise or ride his bike like he used to. He used to love competing in the bike races.
Yes, well, all of these things, poor social functioning, lack of motivation, apathy, and the loss of pleasure, these are what we consider negative symptoms of schizophrenia. And he has been experiencing them for over 6 months now. It is these symptoms that interfere with William's ability to hold a job and maintain relationships and maintain adequate hygiene.
Well, sure, those things are true, but a lot of young people hit a rough patch from time to time. You know, trying to figure out what they want to do in their lives.
Well, in William's case, he's also exhibiting positive symptoms of schizophrenia, and that has been over at least 1 month. He has auditory hallucinations. He told me that his Nana yells at him, telling him that he's useless.
My mother, she's been dead for 5 years though.
Well, William believes that she's talking to him. Also, your daughter mentioned that William believes her boyfriend is an FBI agent and is here to investigate him. Is that correct?
Yes, that's true, I suppose. He did have an outburst towards Greg at our memorial barbecue. Greg had to leave the house.
Well, these hallucinations and delusions, these are positive symptoms of schizophrenia. In addition, William is 21, and the onset of schizophrenia is 18 to 25 in males. I'm afraid that the signs of William's illness all point towards schizophrenia.
God damn it, Billy, what are you doing? Can't you act normal for 5 damn minutes?
Stop it, Jack. Don't criticize him. It's no wonder Billy has all these problems with you yelling at him all the time. You're always so hard on him.
Oh, so now it's my fault. That's great, Kathy. Just perfect. I am to blame for all the kids' problems while you were just the perfect mother. Isn't that right? You're the one that babied him all the damn time. You never made him get a job or do anything, and now apparently has no motivation to do anything. Damn it!
Damn it. Damn it. Damn it. Damn it. Damn it.
Oh, please,
Damn it,
Mr.
damn it,
and
damn it.
Mrs. Freeberg.
Damn it, damn it.
No one is at fault here.
Damn it.
There's nothing that you did or didn't do that caused William's
Damn it.
illness.
Well, if it wasn't us, then what was it?
Unfortunately, Mr. Freeberg, there's not one thing that we can pinpoint as the cause of this. The brain activity is altered in the person with schizophrenia as a result of complex factors, including genetic and environmental factors. In William's case...
Wait. Did you say genetics? Do we need to worry about our other children as well?
Well, as I said, the cause is unknown. While there's believed to be a genetic component, many factors influence brain activity that leads to schizophrenia. At this time, there is no reason to believe that your other children will develop schizophrenia.
So what now? Billy just becomes another crazy bum wandering around, talking to himself and scaring the neighbors?
Jack, stop it.
Oh, admit it, Kathy. When you think of a crazy person, you think of a bum sleeping on a park bench. Well, guess what? Soon enough, that'll be our son.
Actually, Mr. Friedberg, with the medications available today and active participation in therapy, William will be able to reduce many of the symptoms he's suffering from currently. Newer medications for schizophrenics can help with both the positive and negative symptoms that we discussed earlier. And William has a huge advantage in his struggle to regain his health, and that he has a loving and supportive family.
Oh yeah, look at how much good we've done so far. I mean, look at him. How can we help him? We can barely talk to him. I don't know how to help a crazy person. What could we possibly do to help him? It's like after everything, working so hard to make sure he was safe and studied hard for school. Trying so hard to make him be somebody, be his best. And for what? There's nothing I can do for him now. Probably nothing anyone can do.
Well, you'd actually be surprised. A strong support system to a person with a mental illness is so beneficial. It's believed that the person has a 50% reduction in relapse rate for schizophrenics who participate in family therapy as well as medication management. In addition, family education is offered by NAMI, which is the National Alliance on Mental Illness. It's called Psychoeducational Family Therapy, and it includes programs to help you better understand William's illnesses. What symptoms to monitor to prevent a relapse, and the use of medications and their potential side effects. Some research suggests that with adequate family therapy, William's need for long-term hospitalization can be reduced by as much as 80%.
Well, that's good news, I suppose. It's just all so overwhelming right now, Doctor.
Yes, I understand that this is an upsetting time, and there will be time later for teaching. For now, I'll give you a minute alone before we proceed.
Jump picnic into whoa. Skip bus home. Jump picnic into whoa.
Oh, Billy, you were really going to be
Skip
something.
bus home.
And now all these
Bus
dreams,
home.
they're gone forever. How can this be?
Jump picnic
What is your future, my boy?
into whoa.
My sweet boy.
What are we going to do, Kathy? What are we going to do? It is hard enough to be a parent and keep your kid alive and fed with a roof over his head, but now we have this. The doctor talks about a family support, but I don't know. I just don't know. I mean, I haven't a damn clue about how to talk to and care for a person who thinks dead people are talking to him. I mean, for Pete's sake, how can a dead person talk to you? I cannot do this. We can't do this. What about our other children? What about our jobs?
Jack, we have to do this. We don't have a choice. What is the alternative? Give up on him forever? Walk away? I don't think so. I didn't bring a child into this world to turn my back on him when he needs us the most.
But what do we know about taking care of a crazy person?
Stop saying that. He's your son. This has not changed, and that never will. Yes, it's true. We don't know the first thing about this disease, and we haven't a clue how to take care of Billy. But for Billy's sake, we need to learn. Dr. Jonas mentioned the resources available to us, and damn it, we're going to take advantage of them. I will not give up on my son, nor will I let you.
You're right, Kathy. Of course you're right. I'm just so scared for him.
I'm scared too, and sad. Billy had so many dreams, so much he was going to accomplish, his first marathon, climbing the top of Pikes Peak, building splendid things as an architect, becoming a father. We were going to do Pikes Peak together, you know, and now, who knows? But I do know one thing. He has no chance of anything without us. Do you understand that?
Yes, dear, I do.
How is everything in here?
To be honest, Doctor, no, it's not. But the only way it's going to get better is by helping Billy. We need you to tell us how to do that.
Yes, of course. I would be happy to do that. But right now I have a few patients that I need to go check up on quickly. If you have a few minutes